Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Have you ever experienced or heard about a condition where one's legs could emit a strong odor? Yes, it's a thing, and it's more common than you might think. It's a topic that's intriguing and relevant to both the scientifically curious and those in the medical field. This condition, often overlooked, can be a source of discomfort and embarrassment for many. So what causes it? How can we recognize it? And most importantly, how can we prevent it? Today, we will delve into this fascinating topic and shed light on the causes, signs, symptoms, and prevention of this condition. So, what causes a person's legs to emit an unpleasant odor? Well, the reasons are quite diverse. The most common culprit is poor hygiene. When you don't clean your legs regularly, sweat and dead skin cells accumulate, creating a perfect breeding ground for bacteria and fungi. These microorganisms break down the sweat and skin cells, producing the foul smell. Then there are bacterial or fungal infections. Conditions like athlete's foot and erythrasma can cause your legs to smell. The bacteria and fungi involved in these infections emit a distinctive odor as they grow. Certain metabolic disorders can also lead to smelly legs. These disorders can alter the body's chemistry, causing it to produce substances with an off-putting scent. Lastly, specific types of medication may result in smelly legs as a side effect. These drugs can alter your sweat's composition, leading to an unusual odor. Understanding these causes is the first step towards dealing with this condition effectively. Now that we know the causes, how can someone identify if they have this issue? Well, the most apparent sign of smelly legs is, as the name suggests, an unusual or unpleasant odor emanating from the legs. This smell can vary from person to person depending on a variety of factors, including personal hygiene, diet, and even genetics. But the scent is not the only indicator. In some cases, you may also experience other symptoms. These can include itching, which can range from mild to severe. Redness or swelling in the leg area, often a sign of inflammation or infection, can also be present. And in some rare cases, you may notice a change in skin color or texture. Remember, these symptoms can be subtle and can easily be overlooked, but don't underestimate them. Recognizing these signs and symptoms is crucial for early detection and treatment of this condition. If someone suspects they have this condition, how can it be confirmed and what can be done about it? Well, let's delve into that. Diagnosis of smelly legs typically starts with a simple physical examination. A healthcare professional will assess the affected area, taking note of any visible signs such as redness, swelling, or abnormal skin conditions. They'll also consider the smell itself, which can sometimes point to specific underlying causes. In some cases, further tests may be required. These could include a skin scraping to check for bacterial or fungal presence, or a sweat test to identify hyperhidrosis, a condition where excessive sweating leads to odor. Once a diagnosis has been made, treatment can begin. The treatment plan will be tailored to the individual and the underlying cause of the odor. If bacteria or fungi are to blame, antibiotics or antifungal creams may be prescribed to tackle the infection. For cases linked to excessive sweating, antiperspirants might be recommended, or in severe cases, a treatment called iontophoresis, which uses mild electrical currents to reduce sweating. Lifestyle changes also play a crucial part in treatment. This might involve improving personal hygiene practices, such as washing more frequently, using antibacterial soap, or changing socks and shoes regularly. Let's not forget about diet too. Certain foods can contribute to body odor, so a review of dietary habits may be beneficial. With the right diagnosis and treatment, this condition can be managed effectively. So don't let smelly legs put a damper on your life. Seek help and take action. Of course, prevention is always better than cure. So how can one prevent this condition? Well, it starts with good personal hygiene. Regularly washing and drying your legs can help to keep odor-causing bacteria at bay. Don't forget the spaces between your toes. They can often be a breeding ground for bacteria if left damp. Also, exfoliating your legs can help to remove dead skin cells that bacteria love to feed on. Next, consider your choice of footwear. Breathable materials like leather or canvas can help to reduce sweat and therefore odor. Try to avoid wearing the same shoes 2 days in a row to give them a chance to dry out fully. Lastly, any skin infections, particularly fungal ones, should be treated promptly. These infections can often contribute to unpleasant odors. Over-the-counter antifungal creams can be effective, but for persistent infections, it might be wise to seek medical advice. By taking these preventive measures, one can keep their legs smelling fresh and healthy. In conclusion, smelly legs is a condition that can affect anyone. Remember, the key is understanding the causes, recognizing the signs and symptoms, obtaining a proper diagnosis, and following effective treatment and preventive measures. With the right knowledge, care, and treatment, this condition can be managed and prevented effectively. Stay informed, stay healthy. UMCC, your ultimate medical consultants connector.